would like to acknowledge my colleagues and former team members in the huge effort that the amendment has taken. To give you a feel for what I'm going to talk about in this first session, I'm going to give, an overview of what's changed, a little bit about the process, and most importantly, where you'll find the updated schedules, highlight some of the key changes, and then come back to where to find key material at the end. Just a reminder to start out, what is the NEPM all about? And basically it is about getting some consistency across the states and territories on how we assess site contamination. And it's all about protecting human health and the environment where contamination has occurred. So I've highlighted those keywords and emphasising nationally consistent. That's what we're aiming at. Yes, there are variations across the country, but the amendment will, I think, improve consistency, which will help the way the industry works and also how regulators interact as well. This is the current structure of the NEPM. There is a overarching policy framework, that is the measure itself. That's a very short document, only about 14 pages long, and it tends to get put off to the side. It's something that's not often referred to, I guess, because that's not where the technical guidelines lay. Those are in the schedules to the NEPM. Schedule A is a flowchart of the recommended site assessment process, and I'll flash that up in a little while. But it guides you through, which schedules have what, etc. And then the main meat of the NEPM is Schedule B, and that's where the technical guidelines lay, and they'll be the documents that you're most familiar with, I would think. And I've put this up. It's from the measure, and just highlighting, these are, what it actually says in the measure is that these are general guidelines, and they are one possible way of achieving the desired environmental outcome. So that's the protection, the adequate protection of human health and the environment, and I will come back to that. These are the 10 guidelines that you know and love, or know and hate, perhaps. Updates have been carried out to all of them, and I'll put up the list of the new guidelines in a moment. As you can see, there are 10 guidelines. There are 9 in the updated version. As Andrew referred to, and as I did in my opening remarks, this has taken a very long time. The amendment has been through quite lengthy process, starting off with the statutory review, the decision to carry out the statutory review in 2004, 5 years after the commencement of the NEPM. There was an issues paper which first looked at what was wrong, what could be improved, ideas put out and how they could be addressed in the discussion document, and then a review report itself, and the initiation of the variation was in 2007. Public consultation on the proposed changes happened in September, November 2010, and you may have attended one of the public consultation workshops. We had a roadshow there. That material is now on the web. If you go to the SKU website, and I'll explain about SKU in just a moment, this is how it looked on Friday. There will be some updates to this. The summary of public submissions is a large document which goes through individually all the comments that came in, how they've been addressed, and summarising some of the changes. So SKU, Standing Council for Environment and Water, is our current ministerial council. That's where the information on the NEPM will be housed, or where the links are. The NEPM is actually made by NEPC, which is the National Environment Protection Council. They are the people who make and who have the power to amend NEPMs. Some of the guidelines that we refer to include ANZAC, EPHC, the precursor to SKU, the Environment Protection and Heritage Council. These no longer exist. It's now only SKU. However, NEPC still exists, and the ministers, when they agreed to the amendment, sat as NEPC. And all the NEPC material will be housed on the SKU website. So the portal will be through SKU. On their front page, there's a link to NEPMs, and you can select on the right-hand side here, assessment of site contamination. That's how you can access this information here. Okay, moving on to the scope. I mentioned the review. What were the aims? Well, basically, incorporating, as you'll appreciate, since 1999, there's been a lot of scientific developments. Some of the methodologies are outdated, and the review was required to incorporate that new knowledge to maintain credibility in the guidance, as it is the premier or the most authoritative guidance across Australia on site assessment. And the recommendations that came out of the review report then formed the scope for the amendment. So there were quite a few comments that came in the public consultation. For instance, well, you haven't got anything in there on landfill gas. You haven't got anything in there on whatever. And the reason for that is because it wasn't in the scope. It wasn't brought up back in 2010 in the public consultation. And you'll appreciate that the variation, it's taken long enough to do what we had to do. If it was expanded, even more resources and time would have been required. So the high priority items that came out of the review were a desire for the individual bits of the NEPM to work more effectively, for people to link them together better. So the framework effectiveness, and that comes back to the measure itself, the overlying principles, and also how the elements of the guidance are used, so how the investigation levels were applied in practice. The most common thing that comes up there, I guess, would be using investigation levels automatically as clean-up levels, which isn't what they were designed for, and in a lot of cases clean-up perhaps wouldn't be required for those site-specific circumstances. Health investigation levels, so updating those, and also the scope, the particular contaminants that were available. Ecological investigation levels, there was no standard methodology for developing these, and the ones in the existing NEPM, you'll be aware, are for urban EILs, and that they're derived from a number of different ways. It's not terribly transparent how they were derived. The groundwater investigation levels, I'll mention those shortly. Very limited guidance on asbestos. And despite petroleum hydrocarbons being probably the most common contaminant that we come across on contaminated sites, the guidance on volatile petroleum hydrocarbons in particular was quite limited in the NEPM. Management and remediation is a bit of a tricky one, because by the NEPC Act, the guidelines can only address assessment. So the management and remediation principles from the ANZAC 1992 guidance have been looked at, and one or two bits of those have been incorporated into the overall policy framework, the updated measure. But in essence, there isn't very much on management and remediation in the NEPM, and that's because of the way the Act defines it. So the key changes, I'd just like to acknowledge the large number of people that have been involved in this. Some of the work was carried out by the technical working group, but we also drew on expertise elsewhere. And for the HRLs, this was through the National Health and Medical Research Council and NHealth. So the initial drafts were produced by ERM and latterly Jackie Wright, who will be one of our presenters tomorrow, has done the most, or carried out the most recent update and also contributed on the volatiles assessment framework area, together with Greg Davis from CSIRO. The new health and ecological screening levels for petroleum hydrocarbons. This has been again another huge body of work that's been developed over a number of years, undertaken principally by CRC CARE and Eric Treble, who's in the audience today of GHD, one of the two principal authors of the HSLs for CRC CARE. The ecological screening levels were developed by Michael Warren, who will be speaking later on today on the EIL, the Ecological Investigation Level methodology. He took that methodology and applied it to come up with the screening levels for petroleum hydrocarbons. The updated GILs are drawing on existing guidance, so it is very much, I hesitate to use the word automatic, but it's certainly one of the most simple areas of update in the amendment. And also the new asbestos guidance, and there my colleague John Howell from WA Health, the guidance is very much based on the WA Health guidance and also the NHealth publication in 2005. So these are the original guidelines, as I said. B9 I've highlighted. In the amended version you will see the same guidelines with the same or very similar titles, apart from B9, which has been the guidance on protection of health. So this is occupational health, protection of workers during a site assessment. That has been deleted because that is now very well covered by both national and state legislation on work health and safety, removing the duplication there. The guidance on protection of the environment during site assessment, that material has been kept, and it appears now in B2. So the original guidelines are all being repealed, substituted by new guidelines. And as I say, some of them have the same title. One or two of them, the title has been modified to reflect the updated content. So I'd say the main one there would be B2, which is now called site characterization, rather than collection and sampling and reporting, because the content of B2 is now much wider. That's the complete list. So you'll see there are now 9 guidelines. Some of them are broken up into different parts. So the ecological risk assessment, now A is the general framework. The methodology to develop EILs is in part B. And then all the background information on how the EILs for those elements and compounds there are found in C. So that's where all the detailed toxicology, etc. information is found. The ones that you're probably going to be referring most to in the first instance would be B1 and B2 perhaps. B7, we had A and B before, now we have B7, which has the derivation of the HILs. The main part talks about the exposure scenarios, etc., and then a number of appendices that has the detailed toxicology information for the individual HIL contaminants. Where will you find it? Well, again, you'll be able to go through the SKU website, go to the NEPM's page, bookmark assessment of site contamination, and that link at the top will lead straight through to the amended. It will link to where you can access the measure and the new guidelines. It'll most likely take you through to the Common Law homepage. This is where all Australian government, so Commonwealth government legislation is housed. If you search for National Environment Protection Assessment of Site Contamination Measure, this link will be automatic. At the moment you'd have to search for it. It will list the original, and it'll list the amendment, and then it'll list the collated version. Depending which state and territory you are, for instance in WA, we have our own contaminated sites legislation published in 2003. We've had a number of amendments to it. So if we go to our equivalent of Common Law, the version of the Consites Act that we see has all those amendments already incorporated into it, and that's what you'd be able to print out. And it'll be the same for the NEPM. And that means that the reference in your documents will still be to the NEPM 99. It won't be the NEPM 2013. Confusing, but that's how it is. I'm going to go through the ones that I have listed here and also some of the changes to the other schedules as well. So first, and by no means am I expecting people to read this. Unfortunately, I made a terrible copy of this is Schedule A. So at the end of the measure, the flow diagram, which has been updated very much to emphasise the role of a tiered assessment. I'm sure the environmental consultants in the audience are very familiar with this, with a Tier 1 assessment with a PSI and perhaps a fairly straightforward DSI, referring to the investigation levels in the NEPM, and if some of the contaminants exceed the investigation levels, then proceeding to a more detailed site investigation. And as you will see, the amended NEPM has become more complex. The investigation levels, you are able to vary them to a much greater extent for site-specific factors. Yes, it's more complicated, but it also has the benefit that more sites will be treated at a Tier 1, possibly Tier 2 level, and fewer sites will go on to a much more detailed risk assessment, so a more detailed Tier 2 or Tier 3 assessment. The HILs, Health Risk Assessment side, the HILs refer only to soil. The HILs have been expanded quite considerably, mostly to include a lot more pesticides, but also to include Stockholm POP, so persistent organic pollutants. We also have included for the first time vapour criteria. So in the existing NEPM we have soil values, groundwater values, while we're now adding in vapour. The HILs and the interim HILs, these are generally based on Health guidance which came out in 2012. So the guidance on health risk assessment and exposure factor handbooks. That was finally published in 2012. There were initial drafts that came out over a period of time, and at the time of public consultation there was a near final draft of the NHealth document out, which fed into the HSLs. What you will see is that the HILs now they're not based on a multiplication factor for the different land uses. So we have 4 standard or generic land uses in the NEPM. The low density residential, same as before, high density residential, a public open space, developed open space, so not including areas of bushland, things like that, developed open space, and commercial industrial. And in the NEPM 99, these were derived as a multiple of the residential A, the low density residential. Now they're based on considerations of what the actual or what a reasonable exposure for that land use would be. And the exposure pathways have been expanded specifically for that land use, as Eric will be talking about tomorrow, and as Jackie will be talking about tomorrow. Vapor inhalation if you're in a building, dermal contact, so depending on which the scenario is, and all the detail on that you can find in B7. So there's various tables in there which give you the exposure factors and which pathways have been taken into account. The HILs would also vary with how bioavailable the contaminant is. There is some information out there, but it is still fairly limited in how we can apply it, how reliable it is. So unfortunately there's only 2 substances, lead and arsenic, where bioavailability has been taken into account in the development of the HIL. But there are some areas, for example in Victoria, where there is a lot of information on the specific type of arsenic that's present in the soils. These are in the old gold mining areas, and you would be able to vary the HIL, the bioavailability, to reflect that. Otherwise, we assume 100% bioavailability, so a conservative approach. There are also, as I say, a small number of soil vapor HIL, so they have been developed for volatile organic carbon compounds. These are the chlorinated compounds, TCE, PCE, etc. You might be wondering, well, you've got this new vapor, or you've got these new vapor HILs, am I going to have to be applying those everywhere? The answer is no to that. In Schedule B2, there is a vapor assessment framework. It does stress that it should be a multiple lines of evidence approach to rule out vapor if you do have volatile chemicals present, particularly where you've got buildings on top of sources. Do you have to do it everywhere? If you have a large parcel of land, do you have to assess the whole site? No, you don't. In B2, the generic screening distance from the source is a 30-metre radius, or from the edge of that source. And that's because that applies to all chemicals, all volatile chemicals. We know that petroleum hydrocarbons, for instance, commonly biodegrade in the subsurface, and the way the guidance is written, it doesn't rule out a shorter screening distance if that can be justified. And that's one of the common one of the common wordings, I would say, throughout the NEPM. This is what, the wording is there, but this can be modified given justification, and you would need to provide document your justification in your site assessment report. The HSLs, health screening levels for petroleum carbon, you may be wondering, well, why have we got both investigation levels and screening levels in the NEPM? That basically reflects their different modes of derivation. In essence, there isn't any real difference with how you would apply them. What you would do if they are exceeded is exactly the same. So in terms of application, that there is no difference. If they're exceeded, well, that's indicating that further assessment is required. Okay, so for petroleum hydrocarbons, we have the HSLs developed by CRC CARE with the assistance of a project advisory group, which included regulators, members from industry, environmental consultants, from both environmental and health departments. And they were finalised in 2011. And as I say, they were based on the near final draft of NHealth. So there are some small differences in the version that was finalised in 2012, in the NHealth guidance in 2012, but fairly minor, I would say. And HSLs have been developed for both soil, groundwater, and soil vapour. Like all modelling approaches, this includes the HILs, EILs, there are limitations to how you can apply them. They've been developed with a particular land use in mind, so the generic land use is the A, B, C, D. And if your scenario, your site falls out of those, well, you'll either need to modify what is there or carry out a site-specific assessment. The one that we have emphasised more in the final version of the guidelines compared with how the guidelines looked in the public consultation versions is much more emphasis on multiple lines of evidence and the presence of preferential pathways for vapours. So if there is a preferential pathway, by that I mean a direct migration route, so this could be a natural feature, it could be because the source can travel along fractures or gaps around tree roots, etc., into a building, or it may be that the source is interconnecting a utility trench and then the pipework is leading into the building. If you've got that sort of scenario, then I'm afraid these investigation levels don't apply, and again, a site-specific assessment would be required. In the worst case, where you've got a source and a preferential pathway, you may actually be able to smell something inside the building, in which case, well, either it's bad enough that emergency action is required, or you'll be doing some indoor air monitoring, rather than spending time putting together a sampling and analysis plan, mobilising a site investigation, collecting samples. So there are some stops within the guide, or stop and think points in the guidance to put you down the right immediate action, acute risk, or okay, we have time to carry out an intrusive site assessment. From the ecological risk assessment side, we're considering both terrestrial environments and aquatic environments. For the terrestrial, that's where the new methodology comes in, and the EILs in the NEPM, and also ESLs for petroleum hydrocarbons. As far as consideration of aquatic environments go, we have the existing ANZAC guidelines. They came out in 2000, so just after the original NEPM. And there's a lot of information in there in how to assess fresh water and marine water. These have been taken up into the NEPM as groundwater investigation levels for protection of groundwater-dependent ecosystems. We also need to consider mobility of contaminants and leaching to groundwater, so the protection of water resources may be a very important consideration depending on the state and territory. And there are methods for assessing mobility of contaminants in Schedule B3. The methods are really applicable to common metals, so how easily they will leach to groundwater. There are also a number of, in B5B, so in the methodology guideline, the ecological risk assessment methodology guideline, in one of the appendices, there is also a methodology of how to develop EILs, which are protective of groundwater. That's a very conservative approach. And asbestos, they are based on the WA Health guidance, as I've said. Most of the contamination that we come across is bonded ACM, so bonded asbestos containing material. And for the first time, we have criteria in the NEPM for asbestos. There is a much more conservative approach, of course, for where you have friable asbestos or fibrous forms of asbestos. So where there is a risk that fibres may get into the air, of course, that it is a much more significant health risk than where you have bonded ACM, which is in good condition. And as I say, the guidance does differentiate very much between those two. One of the changes that was brought in after the public consultation document was a better integration with work health and safety legislation, regulations and guidelines which have been coming in over the last couple of years or so. The model work health and safety guidance was published at the end of 2011, commencing at the beginning of 2012. And there were various comments about confusion on terminology. So I put this one in. It does talk about, in Schedule B1, it does talk about the two terms, and if you're talking to an occupational hygienist or somebody with a strong work health and safety background, they may be using slightly different terms. Some of the key changes to the other schedules: Schedule B3 on laboratory analysis, B6 on risk-based assessment of groundwater, community engagement, and finally the auditors. So I'm not going to dwell on these. With the laboratory analysis of soils, the original NEPM described methods, and what the amendment does is refer to standard methods by authoritative bodies, so methods which are commonly used in the industry and are published either by Standards Australia, for instance, US EPA, the American Public Health Association. So rather than repeating all these methods, they are referenced from the guidelines. And B3 also provides for equivalent methods developed by the laboratories here, as long as the outcome has been validated against one of these standard methods. So a lot more freedom to a certain extent for how laboratories operate. However, they still need to have accreditation for those methods. We still want to be, we want to be confident that the outcomes of those methods are equivalent. So the new HILs, there are methods in there for the soil contaminants and also the petroleum hydrocarbon fractions. There are methods in there as well. Some clarification on what sample containers to use, and QA, QC procedures as well has been expanded. Leaching procedures, these are the ones that I just mentioned, for assessing the mobility of certain contaminants as well. So you'll see from that that B3 is really addressing analysis of soils, and yet you may be thinking, well, we've got groundwater and soil vapour. In B2, for groundwater, it refers again to standard methods. We don't go into prescribing how to analyse. We refer to standard methods, again, from recognised sources. And again, for soil vapours, there are very good US EPA methods out there, and they are referenced from B2. The update in B6, it looks different, but that's more to clarify the framework, how to use the guidance, but in essence, there isn't a lot of difference in the new B6 than the original, with the exception that it picks up the updated ANZAC guidelines, the latest Australian drinking water guidelines, and also the guidelines for managing risk in recreational waters, which has criteria for recreational water and also some aesthetic considerations, which has updated ANZAC 2000. There's also some additional information on determining or how to assess background water quality. It can be assessing any sort of background, whether it's soil or groundwater, can be quite difficult. So there's, as I say, there's additional guidance there. And the groundwater environmental values have been expanded to include groundwater dependent ecosystems. So where groundwater is perhaps discharging, but also consideration of stygofauna. That's something that in '99 I think we probably paid very little attention to, but now is becoming more and more important in some areas of the country. B8, the community engagement and risk communication. So a change from consultation, stressing it is an engagement process, so it is a two-way process, and the principles, and there's a lot of good material reference that has been developed in the last few years, and indeed including the handbook that CRC CARE produced. Very good material on one of the VIC websites, so that there's quite a good resource listing within B8, as well as some good advice on the situations where community engagement is going to be particularly important for a project. But I do stress that it should be one of the considerations for all projects, some level of community engagement. B9, competencies and acceptance of environmental auditors. The auditor schemes across the states have been brought together, and minimum years of experience, for instance, at least 8 years, I guess, is the minimum that would be anticipated. However, jurisdictions do have some flexibility there. There is guidance on what the process, what the professional competencies required should include, and as you'll appreciate, over time the competencies or the areas of scientific knowledge has increased, and therefore the individual competencies has also increased, and what is required of an auditor. The guideline also can be used by members of the public or local government or any client in helping them, assisting them in how to select an auditor or a consultant, how to carry out, give them an idea, or what criteria should I be looking at. And as I'm sure quite a few of you in the room will be environmental consultants, put up the list there of, well, what should an environmental consultant be able to demonstrate? And very much, it's what you would expect. It's experience and competency in the work, in the services that they're offering, and also a demonstrated commitment to ongoing training and professional development. as new things come along. Where to find key material? I'm checking more or less on a daily basis on, is it up? Has it gone through? And on Friday, the latest was that all the forms have been done, it's been passed, all the legal steps have been, the ministers approved it in April. NEPC Executive Officer Theo Hoy has signed the forms, and it is with the legal people now doing that toing and froing with Office of Parliamentary Counsel and also with the Federal Register of Legislative Instruments. So it's not quite there yet, but I'm told any day, you know, it could be, it's days to a week rather than weeks to a month. So I'll be checking as we go through this week. And the slide that I put up earlier, the SKU website, that's where you'll be able to access it. The other information that's on there that I haven't talked about is the NEPM toolbox. Some of the material that is referenced, for instance, the WA Health Asbestos Guidelines, there are either copies of these documents in the toolbox or links to where you can access them. So there's a link to the CRC CARE website, for instance, for 4 key references which come up time and time again through the guidelines. There are a number of Excel spreadsheets. So there's one for calculating the HILs. You can see how they were calculated, and you can use those or that particular spreadsheet to see how they would vary if that was, you know, vary them for site-specific circumstances. There is also an ecological spreadsheet for the EILs in there, and a number of the review papers that were done as part of the preparation for developing these methodologies. So for the petroleum hydrocarbons ESLs, Michael Warren reviewed some of the material produced in Canada, comparing it with the Australian methodology. His review is in there, and a number of other supporting documents. Okay.